right. Well, welcome to another installment of the Arkansas chapter of the American Academy of Pediatrics podcast. We're still working on a formal name for our podcast, but right now we are very excited to be joined by Dr. Brooke Yancey-Ward, who is going to chat with me today about something that I think is really, really important, and that is postpartum mental health. This is something the Arkansas chapter has been working on for several years now, both from a policy perspective and a practice settings perspective, and trying to encourage more pediatricians to screen for and address postpartum depression and anxiety in their practices, and to help support families with infants and toddlers. So. Welcome, Dr. Yancey-Ward. I'm glad to have you here today. Why don't you take a few minutes and introduce yourself for our listeners?
Yes, definitely. Thank you so much for having me. And you can totally call me Brooke. But yeah, so I am Brooke Yancey-Ward. So I have my doctorate in clinical psychology, and then I also have my certification in perinatal mental health. So I'm a pediatric psychologist at UAMS and Arkansas Children's Hospital. So I've been here as faculty since 2022. Before that, I was a postdoctoral fellow at UAMS and Children's from 2019 to 2020. So I work in our NICU, in our neonatal intensive care unit at ACH. I absolutely love it. I love working with these mamas, the dads, and their babies. They have a very special place in my heart. I actually have a 2-year-old son and then a 6-month-old son. So I'm also, kind of going through, I've learned about it, studied about, postpartum mental health, and actually now have gotten to live it and experience it. So I feel like it just helps me relate to these mamas even more when I get to see them on the NICU. So yeah, it's a little bit about me and kind of my daily um, routine is a lot of just spend time in the NICU, rounding with teams. We have neonatologists on the NICU unit as well as pediatricians, so I get to work with the whole team up there.
Great. I love it. And I love that you have like the mom layer to add on to
Mhm.
your experience. Like, I've always heard from pediatricians that they're like, I don't totally trust the pediatrician until the pediatrician has had babies themselves.
It changes things for sure.
It does really help too. I know my boys are 4 and 8, and I know and the second one was born during COVID, and so it sounds like you were kind of some of that mom during COVID time, and that was all.
Yeah,
I mean, for those of us in the healthcare space, was a stressful time to figure out how to balance all
absolutely.
the things, and it was definitely. I know I definitely failed a couple of my failed is the wrong word, but I had some concerning numbers on my postpartum mental health screeners myself, so definitely been there.
Absolutely. And with COVID, that throws a whole big wrench into things too with the stress levels. So absolutely understand that. Oh, I bet you were not alone in those a few little items that might have been a little escalated or more than normal.
Well, I love that you are in the NICU too. I think that's such a really important place, and a lot of families maybe not expecting to have a baby yet, or not expecting to have a baby with health problems or other things that are going on. So I'm sure that you're really supporting some families in some really critical times. Yeah.
Yeah.
Well, good. Well, let's talk a little bit just about what some of the mental health disorders that you think women should be aware of that can develop during pregnancy or during the postpartum period, and then kind of honing in on any risk factors that moms should be aware of, or their caregivers and partners.
Yeah, absolutely. So we have what are known as perinatal mental health conditions, or sometimes they're referred to as perinatal mood and anxiety disorders, or PMADs, with the key word of perinatal referring to the time period during pregnancy and then through that first year postpartum. So these are conditions that can occur during pregnancy, postpartum, or after the loss of a baby, which I think is also important to remember as well. Um, so these include postpartum depression, which may be one that many people are more familiar with or maybe have heard of before. There's also postpartum anxiety, as well as prenatal anxiety, so during that pregnancy period, perinatal panic disorder, perinatal OCD, perinatal psychosis, perinatal PTSD, and then bipolar disorders. And it's also important to mention that these disorders may not only affect moms, but also other family members like dads. And perinatal mental health conditions are actually the number one complication of childbearing. And according to the World Health Organization, about 10% of pregnant women and 13% of postpartum women will experience a perinatal mental health disorder. So when you think about 1 in 10. Um, And then as far as risk factors, we definitely know from the research, the literature tells us a lot of consistent risk factors to be aware of. So these include having a family member with a history of mental health conditions, a mom's own mental health history if it's significant for anything, financial stress, a history of abuse, marital stress, unplanned or unwanted pregnancies, definitely a risk factor, any sort of complications during pregnancy or delivery, having a baby in the NICU, having multiple. So we know that being a parent of twins or triplets is definitely going to heighten that stress level that compared to a singleton pregnancy for sure, as well as having a medical condition such as diabetes. So the theme here is really this underlying stress that can definitely contribute as a risk factor. And this makes sense because we know that when our bodies are in a heightened state of stress, this can affect our bodies in a way that can make it more likely for us to experience a mental health condition. Um, and there are also certain populations that might have a risk factor or be more prone to experiencing higher levels of stress during pregnancy, like military families, teen parents, single parents, and parents of color as well. We know from looking at the research that they might also be more prone to some of these conditions as well.
Wow, well, that is, that's just, that is so much broader than I actually knew about. So thank you for
Uh,
sharing all of those. And I love that you brought in dads too. I think it is
mhm.
it needs to be hopefully a team effort, when we're having
Yes.
kids, and it helps so much when you have two parents who are able to fully engage. And I know that
Yes.
sometimes. What can you talk a little bit about? So when mom or dad, when the family is experiencing some of these perinatal uh mood is perimaid PMADs, right? Is that what
Yes, you can just stick with me now. That's perfect.
when they're experiencing these PMADs, can you talk a little bit about what that means for the health of a child, and why is mom's well-being and the parents' well-being so important?
Yeah, so there is a lot of research regarding both short and long-term outcomes for infants and moms' mental health. So research has found that moms who exhibit depressive symptoms, like withdrawal, being really irritable a lot, being more disengaged from their baby, can greatly impact their baby's development in multiple areas, including emotional, social, behavioral, cognitive domains. And dad's definitely affected as well. There's not quite as much research on dads, unfortunately, but we have to remember they're so important too for our baby's mental health and long-term development. We know that poor maternal mental health can also lead to elevated safety risks for the baby. This is usually a result of inadequate supervision. So if you think about it, if a mom's really depressed and she just can't even get out of bed, she might not be able to actively supervise her baby or her toddler the way we would, would be more ideal. Um, it could be a poor implementation of safety rules. It could be that they're misusing car seats. Again, if they're just so anxious or depressed or just going through a lot of mental health or just not focused on adequately installing this right now. An overall increased risk of maltreatment and hostile parenting behaviors like yelling. So we know that when we're more stressed, it's hard for adults, it's hard for any of us to really regulate at all times. We all, have our moments where we're like, oh, I shouldn't have yelled like that. But of course, that stress is just going to fuel that. And so our mamas who are really going through a hard time with their mental health are going to be more likely to engage in some of this. And we know on the flip side that a mom having good mental health and having strong mental health improves the attachment that they build with their babies. And this good, secure attachment style can lead to the baby having better emotion regulation skills, better cognitive development, as well as academic and even occupational success long term,
Oh,
as well as higher self esteem, better resiliency, better problem solving and communication skills, more empathy and social competence. They're better at social relationships when they get a little bit bigger and wanting to make friends. And then just overall better mental health for the child when the mama's mental health is good, it definitely helps her babies long term as well.
I love that because all the things you're talking about in the world of of hiring and jobs, those are a lot of the soft skills that we talk about, wanting people to be who can talk to other people, engage with other people in a positive way, use logical decision making, be resilient when something
Absolutely.
bad happens. Those are Those are definitely like life skills. So it's great to
Absolutely.
hear
Yes,
that investment in mom's mental health when she has a new baby, and dad's mental health when he has a new baby. That is a really important long-term thing for a
for
baby.
sure.
And so much
Yeah.
of that brain development happens in those first few years, right?
Absolutely. So we know like in the first 5 years is when a ton of that brain development, especially the first 3 years, but even up to the first five, so much brain development's happening. So it's just so crucial that we get that good secure attachment as best we can. And that is we could have a whole separate podcast on attachment, but one thing that I will mention that's really cool and really promising is that even if a baby has a more insecure attachment style in the beginning because mama is struggling with her mental health or wherever it might be. The research shows that babies can absolutely change from an insecure attachment style to secure by preschool age if mama is able to kind of get the help she needs, implement better coping for her and for baby. So just to throw that out there, I love to tell people about that because it just helps instill hope that, even if there's an insecure attachment in the beginning, we can definitely change that to secure over the first couple of years of life.
That is so great. So I mean, let's talk about what are some of those coping skills and those strategies that
Yeah.
you use for moms after or others after they have a baby?
Absolutely. So, the literature, again, I like to go to the research. It tells us that there are some really good coping skills that mamas can use. And so, evidence based approaches really focus in and really support cognitive behavioral strategies. So, this includes things like behavioral activation. So, I tell mamas this basically just needs to get up and moving when they're medically cleared to do so after delivery, of course. We don't want them doing too much too soon if this is like new postpartum. But whether it's just dancing in their living room with their baby to a music playlist, walking in the park with their little one in the stroller, walking their dog, hiking, taking an exercise class, doing yoga in front of the TV in the morning, stretching, gardening if they enjoy that, being outdoors. Or just taking a really slow walk down their block if they're still just kind of in that beginning phase. So these activities can all help to release those feel good hormones and feel good chemicals in our brains that just kind of naturally help to reduce stress and anxiety. Other things include positive affirmations. So this is one of my favorite ones because I tell parents, this is something that we can do anywhere, anytime, as well as deep breathing. And I'll talk about deep breathing in a second too. But so with positive affirmations, it's just what it sounds like. So I encourage mamas and dads, of course, to just tell themselves really empowering and encouraging things like, I'm strong, I got this, I can do this. I explained that, our thoughts are so, so powerful over how we feel in those emotions. And so just practicing saying those positive affirmations can really, really help and actually rewire synapses and neural connections in our brain to naturally think more positive, healthy thoughts. So just practicing thinking those healthy thoughts is so, so good. Um, also, another cognitive strategy that's supported in the research that I like to talk about with parents is what advice would you tell a friend or a family member if they were going through something similar, especially our parents who might be in the NICU or have an unexpected complication or prenatal diagnosis or something like that? What would you say to your sister or to a friend or your best friend if they were going through this? How would you support them? How would you uplift them through this really hard time? And then take that advice and tell it to yourself because we can be so good at giving other people advice, but not always so good at taking our own advice. So I like to talk about that as well. And then, of course, the deep breathing, because again, we can do that in the car. We can do it if the mama's at work, if she's home, anywhere she is where she's starting to feel a little bit more stress, if she's in the middle of the night doing a feed for her baby, if she's, waking up early and feels so sleep deprived and is getting anxious just fixing the first bottle or trying to make herself breakfast, whatever it is, just practicing those good deep breathing skills because deep breathing will actually biologically calm our body down. And then our body sends a message to our brain that we're safe, we're okay, we don't need to be anxious. So that's a really other great coping skill that I like to give mamas for sure. So just those little, 3 or 4 things in our toolbox that we can share with moms and dads too. Always want to include dads in there.
Oh,
Is so, so good.
that's so great. You know, one of my littles both have done, I guess their school does oh, what's it called? Oh, I'm forgetting the name of it. But anyway, one of the things they've learned at school is like all these calming techniques. And one of them is they smell a rose and blow out their
Yes.
candle. And I love it so much because I also do it in my head. I'm like, let's blow out
Yes.
your candle for a minute. Mommy needs a minute.
Right,
But it
right.
it calms them, and it also reminds me, to do that. I know you obviously can't do that when you have a NICU baby and they're still small, but it's something that I think is really a good one to bring up with your kids as they start to be able to understand how to regulate their own bodies too.
Absolutely, and just giving them that kind of like imagery of, we're smelling a rose, things like that. We talk also about, pretend like you're blowing up a balloon in your belly and then letting it out. So definitely those good like kind of visual imagery kind of things to go along with it is great for kids, and they tend to really, really love that for sure. So I love that you do that.
Conscious discipline is what it's called, I think, with the class,
Yes,
like a class
yes,
management strategy for pre-K. But anyway, I love it so much.
so
Um,
good.
and so, it sometimes can feel really hard to find the space for that self-care, for taking care of yourself. Talk about why it's so important and how you can like work those little bits into your day in a way that lets you avoid kind of getting to the brink.
Absolutely. So we know, and I tell parents this all the time because as parents, we're always, quick to put ourselves on the back burner. It's okay if we, miss a meal or miss a couple hours of sleep because we're doing this, we're doing that, and always putting our kids, first. And so I get that. I get that it's so easy to put ourselves on the back burner. But I tell parents it is so, so important that we fill our own cup, because when we do that and we're feeling our best, we can then show up the best for our kids. So it's not selfish to do self care. It's actually really good for our kids. So things that they can do during the day is like having a goal that we're going to write down even just 1 to 3 things that we're grateful for before bed each night. And the thing with this one that I'll tell parents is that when we get in the habit of writing down things that we're grateful for each night before bed, our brain actually learns to be trained to look for the good throughout the day. Because if I know that before I go to bed that night, I have to think of my 3 things, I'm going to be looking for it all throughout the day. What are my 3 things going to be tonight? And that way you're kind of training yourself to look for those positive things throughout the day. So I love that one. Um, Using our social support network. So a lot of times new moms or new parents feel like, I don't want to burden anyone. I don't want to, add anything to their plate. But the truth is, we want to help our family members and our friends who are new mamas and new parents. So definitely use that social support network. If they can help with chores around the house, if they can help just bring you a meal, set up a meal train, just come and hold the baby while you take a shower. Just all those little things. I also talk about scheduling date nights with their spouse or their partner, because again, we put ourselves on the back burner, we put our relationship on the back burner, but having a good, strong marriage is also so, so important for our kids, to see and to model that. So definitely prioritizing that time. Having something to look forward to, like scheduling things with our friends for the weekend, even if it's something just like getting coffee and we're bringing the baby with us. That might be something we can still look forward to. If their faith is important, I'll talk about doing a daily devotional, saying our prayers. That can definitely help. Watching feel good movies. A lot of parents love like the adult coloring books because coloring and drawing can be so relaxing, or some other kind of artsy or craft project that they like to do. Journaling, reading, prioritizing that sleep as best they can. Of course, being a new parent, it can be hard to always get in that sleep, to get in our nutritious meals, but I talk about how that's important too. And then just giving themselves a lot of self love, compassion, and grace, being patient with themselves, because they're learning if they're a first time mom. And even if they're not a first time parent, they're still adjusting to another baby at home. So definitely being good to ourselves and being kind to ourselves is so important too, for sure.
That's so great. I love to do puzzles. They help me to like
Oh, that's a
at
good
my
one.
phone. They I like and they help me to like sometimes my husband and I will do like he's not as big into puzzles as I am, but I'll be working on a puzzle and it helps us to kind of just, have that very distraction free time to chat, talk to
Yes.
each other and like wind down, but not feel like it's like I don't know, it's a nice way to have a calm minute before you go to bed or whatever.
For sure. Yeah, puzzles are such a good one. I love that y'all do that. That's so good.
It's kind of fun. I don't always have one going, but it's always nice to get a new one done. So
Yeah, yeah, yeah.
Let's talk about moms who and dads who are struggling, who've tried all this work to do self-care, prevention, and other things. What resources are available for pregnant and postpartum women and their partners who are struggling with their mental health?
Yeah. So one organization that I absolutely love, and I've told like my colleagues about this, I love to talk about this organization. So it is called Postpartum Support International, or PSI. So they're an organization that has a website with resources for both parents and for professionals, including information about national support groups. And the support groups each have a specific area or topic that they focus on. So there's support groups for dads, support groups for parents who have been through fertility struggles, NICU parents, military moms, moms who have experienced an abortion and then they want support after following that, parents of really high need babies, among many, many others. So they have a lot of good support groups on there that are national, virtual to make it a little bit easier on parents. They also have a helpline that parents can call or text to get just basic information, support, and resources. There's also a tool on their website, and this is one of the main things I love about them too, to find local mental health providers who have specialized training in working with perinatal mental health. And so, by the way, too, mental health counselors and psychologists can get certified in perinatal mental health after receiving additional training and passing a national exam. So, I really like to find providers who have this special certification because it tells me they have extra training and experience in working with these parents specifically. The website also has other trainings for professionals. They have an annual national conference as well that professionals can attend to get more education and learning experiences. I actually went to their one. It was in July. It was in New Orleans, and it was really good. And I also just encourage moms to be really honest with their child's pediatricians and their own OBGYNs about any symptoms they're experiencing, because they can also help moms with referrals to local providers, or connect them with a social worker if they have a social worker in their clinic, to find out about resources as well. So definitely there's a lot of things that exist out there for these parents. That's really, really good stuff.
For the folks listening, is there you so you can go out and search. Do you know for people with the PSI certificate in
Yeah,
Arkansas, and you have that, right?
I do.
You have,
Yes.
do you know how many others are in Arkansas approximately? That's a pop quiz question.
I love that question. So I did put together a local resource handout for our NICU mamas. So I did recently look at that website to look at Arkansas, and there are quite a few. I would say probably at least 10.
Oh, good.
And a lot of them also offer telehealth. So a lot of them are more central to like central Arkansas area. But say we have a mama that's more rural in the state, they can do telehealth as well. UAMS also has a 6 week postpartum um, kind of mental health support program that they do. So UAMS is also a good resource as well for those parents, especially parents who might have Medicaid, because UAMS does accept Medicaid for their mental health resources.
Awesome. Well, that's great. I did not know that. Good to hear.
Yeah.
Well, we know, you were talking about being honest with a pediatrician or your OB-GYN, and we know that postpartum mamas, particularly, I know we know mamas do a lot of the postpartum or the early childhood care. They see their child's pediatrician several times before they actually go back for their own follow-up visit at 6 or so weeks after they
Hmm.
have a baby. What should pediatricians know about postpartum depression, anxiety, and other mental health struggles, and how can they be part of the team that's helping take care of that whole mom-baby dyad?
Absolutely. So I love this question because pediatricians are absolutely often the first line of defense that we have in trying to recognize these mamas who are struggling postpartum. So I think one thing that's so important for them to know is the difference between normative postpartum reactions, often referred to as the baby blues, and we'll get into that, versus symptoms that would be more concerning, and to be aware of general prevalence rates for each category. So for baby blues, this is pretty common. So baby blues actually affects about 60 to 80% of new moms. It is not a disorder, and moms still report feeling happy overall, no suicidal ideation or thoughts. They still have a lot of pleasure and joy in being a mom and an overall appropriate amount of worry. So we know that mamas are going to worry. and their level is still within that kind of normal range that we would expect for a new mom to have. The symptoms can include exhaustion, which we should not be surprised about at all. Maybe being a little tearful. Their mood might be a little labile, a little bit more reactive than normal to things. The time frame for the baby blues is about 2 days to 2 weeks after birth. And it usually peaks 3 to 5 days after delivery. So, like you're saying, the pediatrician, we know the pediatrician has that, newborn first visit just a couple days after that baby's born. And then, so that's a great time to check in with that mama, as well as if that baby's coming back for weight checks or anything else that's going to be a more frequent visit. Like you're saying, like before that mama goes for her own, probably like 6 week postpartum visit with her OBGYN. We know that hormone fluctuations and that sleep deprivation, like we talked about, really account for a lot of the symptoms that we see with baby blues. The symptoms can be similar to postpartum depression, but they are less intense, which is really important to remember. So that they're more tearful rather than having any sort of like extreme sadness. And these symptoms do not extend past 2 weeks postpartum. And overall, these symptoms will resolve on their own without any sort of medical assistance. And it's just a normal period of adjusting to new life with a baby. On the other hand, about 15 to 21% of pregnant women experience moderate to severe symptoms of depression or anxiety. And then, as far as postpartum, or during that perinatal period, about 1 in 5 women and 1 in 10 men experience depression or anxiety. And and remembering back to that earlier statistic, about 10% of pregnant women, 13% of postpartum women will experience a perinatal mental health disorder. So again, think of it as 1 in 10 patients who are under the age of 1 year, that a pediatrician sees during any given week may have a mom who is struggling. And symptoms of a perinatal mental health disorder include feelings of guilt, shame, feeling hopeless, anger, rage, again, just being really irritable, or also scary or unwanted thoughts, or called intrusive thoughts. There might be a lack of interest in the baby or having a really difficult time bonding with their baby. Losing joy in that interest and pleasure in things they previously really enjoyed doing. Sleep and appetite disturbances, which again, I always tell too, like this can be a tricky one to determine because we know that appetite and sleep can fluctuate normally after a new baby comes home. They might have crying and sadness and then this constant worry or racing thoughts. So this would be above that level of appropriate worry that we would see in the baby blues. They might have some physical symptoms like dizziness or nausea. And then also, this is one that we also really want to key in on, any possible thoughts of harming the baby or themselves. So this is a key difference too from the baby blues. So any suicidal thoughts, plans, or intentions, we have to take really, really seriously. And these mamas need to be further evaluated to see what the next steps need to be for that mom and to get her the help that she needs to protect herself and the baby. So overall, if a pediatrician has concerns, I really recommend they encourage moms to utilize this PSI resource. And of course, if there is a social worker, if they're lucky enough to have a social worker in their clinic, they can consult them, and get that mama connected to additional resources that way as well.
Awesome. Those are so many great tips to on kind of parsing those two out, and really understanding how to get started on helping mom get some help and support. Um, so just to delve a little deeper on what happens in the pediatric clinic and go into some talk about screening. So I know the American Academy of Pediatrics recommends screening parents and caregivers for postpartum depression and anxiety disorders during that first year of life. Can you talk about why that recommendation is so important?
Yes. Yes, screening is so, so important. And this is because of that prevalence rate of postpartum mental health concerns, such as depression, and the negative impact that this can have on a baby's development. So we know that perinatal mental health conditions can occur at any point throughout pregnancy through the first year of a baby's life. And the sooner we can screen these mamas, recognize symptoms of concern, and connect them with appropriate and good resources, then we can get them intervention as early on as possible, which can be paramount for helping these moms, and of course will be so beneficial for their babies as well. So yes, American Academy of Pediatrics has put out that recommendation. So has ACOG, or the American Congress of Obstetricians and Gynecologists. And specifically, we know that American Academy of Pediatrics recommends screenings at 1, 2, 4, and 6 month visits. ACOG is a little more vague, just one time during that prenatal period. On the other hand, PSI, the Postpartum Support International, they recommend the most thorough standard of care for screenings, and they call for screenings for at the first prenatal visit, again during the second trimester, again in the third trimester, that 6 week postpartum visit, as well as 6 months and 12 months postpartum, and also at the 3, 9, and 12-month pediatric visits at the pediatrician's office. So pediatricians with these screenings can help identifying signs for maternal depression, stress, or anxiety, and provide overall support for the caregiver's well-being. They can also encourage parents to have, some of these kind of tools in our toolbox that I think of are like things that the pediatricians can definitely recommend and encourage for mamas. Like having self-compassion, having grace on themselves, getting self-care as they're able to, practicing those positive affirmations, that deep breathing, just those little kind of quick tips that they can give mamas. And then simply listening to these parents and giving them that outlet to talk can also be so therapeutic in and of itself. So just being a listening ear, it can also be hugely substantial for these parents, just having that person there to talk to.
Yeah, I love this. And I've never really actually thought about this. So with but you work in a NICU, and so I'm going to ask. So when baby's in the NICU and not going in for regular checkups at their community pediatrician, how does that work in y'all setting too?
Yeah, so that's a great question. So, NICUs, at least every NICU unit that I'm aware of, does have social workers assigned to that unit. And I know that at the ACH and UAMS NICUs, they do follow. So again, Postpartum Support International has put out guidelines for NICU screenings as well. And I'm not entirely sure exactly like when those time points are, because it kind of depends on how long that family's there, because we have some babies that are there for 3 days, some babies who are there for 3 months, up to even a year. So those guidelines kind of differ very, depending on that length of stay. But our social workers are definitely screening our mamas at certain time points, depending on that national guideline. So that's a great question. Yes, our social workers are fantastic and phenomenal resources for that, for those parents.
That's wonderful. We are working hard on trying to provide some additional support to our members on adding integrated behavioral health services to their practices. And we know our healthy step sites, there are about 20 healthy step sites around the state of Arkansas that have an embedded person. They're not necessarily a behavioral health care provider, but they are somebody to help families navigate all the resources that are out there to help support them for infants and toddlers. And then integrated behavioral health can reach whole families potentially, even if the
Yeah,
pediatric practice is able to add, parents and caregivers to their roster of patients if they want to do that,
yeah,
or just help navigate to additional community resources for that. I know
yeah.
one of our Healthy Step sites actually, when they started screening for maternal depression, it was in 2022-ish.
Mhm.
But one of the things that came out of that was, I think I want to say 70% of the moms had a positive maternal depression screener during.
Yeah.
I mean, it
Wow.
was really, really, really intense numbers, and just being able to have. I know a lot of our practices refer to UAMS AR Connect Now as a resource to help kind of bridge into local community care
Mhm.
and things like that. But it is
Yeah.
definitely out there in Arkansas. And I also, one of the other things I was going to mention too, recently, the Arkansas Center for Health Improvement um, did an analysis of moms' behavioral health care access in that year postpartum, and that many moms who had an ER visit or a hospitalization for a behavioral health concern had no follow up. Not all the moms, the many did, but the majority did not have any follow-up care in the community after some sort of severe behavioral health event. Uh,
Yeah.
really thinking about pediatricians being that line of intervention when mom may not be taking care of herself, but
Right.
she's taken her baby to the pediatrician to be able to help intervene and help make sure that mom is really prioritizing her own.
Yeah. Yeah, for sure.
There's so much happening in this space, and I think so many improvements being made. Well, Brooke, thank you so much. What is, if there were one takeaway that you wanted listeners to have from this podcast, what would it be?
Yeah. So I hope each listener listening to this podcast just knows that they are a difference maker, not only for the children they care for, but also for their moms and their dads, because this in turn greatly impacts our pediatric patients and their long term health and development too. So you can absolutely take some of these strategies that we talked about today and share these with caregivers, tell them about the resources and the professional support that exists specifically for them. And I would say too, like, you know, these listeners, you have so much knowledge, and knowledge is power. I mean, you can make such a huge difference for postpartum parents and these babies. So you all are just like superheroes, and I just love that I've had the opportunity to talk with you all today. And yeah, it's been lovely. Thank you so much for having me. And like I said, I'm at UAMS in children, so if anyone wants to reach out to me anytime with any additional questions or anything that I can do to help, please let me know. Please feel to reach out anytime because I'm here for you guys. I'd love to share anything that I do know. If you have a question that I don't know, I will find the answer.
I do not doubt it. I really appreciate you joining us and for all that you do every day to take care of lots of families in our state who need that. So I appreciate you joining us, and we hope to talk again soon.
All right. Thank you so much.